COVID, my brother, Mr. Sakaja, who resigned on his own motion, and replace him with Dr. Lagat, Senator. And I think that my
Senator, we move the motion.
Yes, I beg to move the motion. Yeah, I apologize. Mr. Speaker, sir, I beg to move the following motion that pursuant to Standing Order 187 and 189, the Senate approves the nomination of Senator Dr. Christopher Andrew Lagat, MP, to serve in the ad hoc committee on COVID-19 situation in Kenya to take up the vacancy occasioned by the resignation of Senator Johnson Sakaja, CBS MP. Mr. Speaker, sir, Senator for Nairobi, Senator Johnson Sakaja, resigned from that committee, and we thought of giving the opportunity to Dr. Andrew Lagat, who is very well educated, very competent, and we strongly believe that he's going to do a good work once he gets into that committee. Mr. Speaker, sir, we'll also bring a dimension on the COVID situation in the Rift Valley region, which currently needs good representation in that committee, so that we can enrich the deliberations that will occur in that committee. Mr. Speaker, sir, the former member, that is Mr. Johnson Sakaja, Senator, sorry, I apologize, has done a good job, but we think that it's time now also we give Dr. Lagat that opportunity to also serve in that committee. Allow me to call Senator Cheriot to second the motion. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, I want to second this motion that has been tabled by the whip of a majority side, that is inviting Senate colleagues to approve the nomination of our colleague, Dr. Lagat, to serve in this COVID committee that was set up about 3 or 4 months ago. And up to this stage, I think they have furnished this House with about 7 or 8 reports. The only challenge that I have for Senator Dr. Lagat, as he joins this committee with the approval of the House, is that he ensures that actually their reports are actioned and they just don't become reports that fill up and gather dust in the Houses of Parliament. Senate colleagues have requested on many occasions, and this is a request that I had personally made to the chair who has resigned, that can we be furnished with all expenditure that various county governments has used. It is in my best interest as Senator for Kericho to know how much the county government of Kericho up to this particular point has spent in terms of preparation for all COVID-related activities. Because the reports that you're getting, Mr. Speaker, are disheartening, and this is a view that is shared by each of our Senate colleagues. At least that is a list that we could do, because we are a house of oversight. The second and the most important thing, and I raised this last week, Mr. Speaker, while we were debating the issues that were before this House, is that we keep on reading in the newspapers as colleagues in the Senate that County X has this number of isolation beds, this number of ICU beds. Can we be furnished with documents confirming or disputing that report as colleagues here? It is a shame that as senators in this House, we have to rely on newspaper readings to know the amount of preparedness, because some of these facilities you are not able to tell where the county governments have placed them, and it will be important to see the filings that they are giving to the Ministry of the Ministry of Health, so that you counter-check and verify. Otherwise, somebody seated at Afya House may very well read that Bungoma County has 300 isolation beds that have been set up, but it is only Senator Moses Wetangula, when he reads and sees that these beds are stationed in a particular station, that will be able to tell the ministry that this is a fraud. And we know these are things that many of the governors who are in offices can do. Therefore, our colleague, Senator Dr. Lagat, I wish you well as you serve in this committee. Bring in the vigor and the energy that you always known to portray. I know him also to be a man of prayer, so I know he will not be tempted or distracted by anything else. He will ensure that he serves to distinction. I mean, Senator Dr. Langat will always pray. On top of the Senate prayer, he will also pray for this country in the course of, not to say that Senator Sakaja is not a prayerful man. He's a Christian like myself. Thank you, Mr. Speaker. I second.
Honorable Senators, I propose the question which is that pursuant to Standing Order 187 and 189, the Senate approves the nomination of Senator Dr. Christopher Andrew Langat, MP, to serve in the ad hoc committee on COVID-19 situation in Kenya to take up the vacancy occasioned by the resignation of Senator Johnson Sakaja, CBS MP. I put the question which is that pursuant to Standing Order 187 and 189, the Senate approves the nomination of the Senate Dr. Christopher Andrew Langat, MP, to serve in the ad hoc committee on COVID-19 situation in Kenya to take up the vacancy occasioned by the resignation of Senator Johnson Sakaja. As men are of that opinion, say aye. As men are of contrary, you say nay. The ayes have it. Next order.
Order number 9, motion, approval of the third basis for revenue allocation among the county governments.
Before the chairman comes, I think Senator Khaniri did raise an issue on why we have the two similar motions. The matter came up in SBC, and SBC decided, ruled, or by consensus, said that in the event that the chairman again does not appear, there is a fallback position so that this issue is disposed of with. Now that, and the SBC did agree that if the chairman moves it and I can see him here, then the other one will technically be out. Senator Chairman.
Thank you, Mr. Speaker. As I move the motion, Mr. Speaker, I want to note that indeed the Commission, the Parliamentary Service Commission, is doing well. I can see we have new uniform. We have some new ties that I don't know why I was never given one. But having said that, Mr. Speaker, I beg to move the following motion, that the Senate adopts the report of the Standing Committee on the Finance and Budget of the third basis for revenue allocation among the county governments, laid on the table of the Senate on Monday, 30th July 2020, and that pursuant to Article 2017 of the Constitution, approves the proposed third basis for revenue allocation among the county governments as contained in the report. Mr. Speaker, I know this is an issue that the whole country is waiting that the Senate do make the approvals so that we can move on and develop the country or give services to our people. Mr. Speaker, the Constitution, Article 2017(1), really demands that we need to do exactly what the motion seeks to do, and that is to determine the basis for the allocation of revenue among the counties. Mr. Speaker, the first parliament, the 10th parliament in November 2012, did determine the revenue sharing formula for 2013-2014, 2014-2015, 2015-2016, 2016-2017, while the 11th Parliament in 2016 determined the revenue for 2017-2018, 2018-2019, and 2019-2020. And the two have been in existence, Mr. Speaker. This motion seeks now to request the Senate to determine the sharing formula for the years 2020, 2021 to years 2024, 2025. Mr. Speaker, as it were, Article 2016(1), the Constitution provides the principal function of proposing the revenue sharing formula to CRA. And Mr. Speaker, the CRA, or the Commission of Revenue Allocation, did table a report or a proposal to the Senate on 30th April 2019. Mr. Speaker, further, Article 217(2) provides that in determining the basis of revenue sharing, the Senate shall take the criteria in Article 201(1) into account, request and consider recommendations from the Commission on Revenue Allocation, consult the county governors, the cabinet secretary responsible for finance and organization of county governments, and finally, and the fourth, invite the public, including professional bodies, to make submission to it on the matter. Pursuant to this provision, Mr. Speaker, the committee, in considering
socializing, that's the idea. The idea is to stop socializing and therefore preserving physical distancing. So it will defeat the purpose if we said that you are not allowed to do that, and then you go to the same place carrying your shupambili. No. Going forward, sausage bili, soda moja. It's a new norm. Sausage bili, soda moja. And if you go to another place, you do exactly the same thing. So I think that clarifies that particular aspect, because people have been telling me this morning that if we go to a restaurant with my own wine, am I okay? And I've said, no, you are not okay. The idea is for no alcohol to be seen in any of those premises. And if you buy and you take home with a whole bunch of people, effectively transforming your home into a shabin or a karumaindo, you will still be contravening the regulations and therefore liable to punishment. Essentially because once you pass a certain number, as you know, the 15 number, then you are assumed to be a gathering with the consequent results. But I'm not saying that we are prohibiting you from walking into a supermarket and enjoying your kanywaji and at home. Subsequently, those supermarkets and those outlets, such as big wines and spirit areas, which we have not closed, must not be converted into parking lot drinking sprees, where people go and park cars outside and start drinking. So we are hoping that Kenyans, and I pray that Kenyans will take this thing with the spirit that it is meant to be, that we are getting a lot of our young people turning positive as a result of the socializing that we have experienced and we have seen over the past 21 days. Having entered this critical phase of the spread of the disease within the communities, we also trust that despite the few restrictions set in place on the work environment, when you get to your workplace, you will have sanitizers, soap and water to clean hands regularly, as we have insisted that you do. We have also advised that the measures of staying at home, particularly in this very cold weather, the measures of working from home, staying at home for those who have comorbidities, or for those who are 58 years and above, the advice that you have been given on this measure, you should take seriously and try as much as possible to operate from your own domestic premises. COVID-19 has essentially turned us into lethal bullets. that could kill our loved ones if we are careless. I have become a bullet, and you have become a bullet. We are dangerous. You are dangerous. I am dangerous. Because I can kill somebody, you can kill somebody. Not intentionally, but it is now possible. So, as we have continued to say, we cannot and we shall not treat the situation normally. When you get home and you wash your hands and do all the things that you need to do in accordance with the protocols, please also do the same to your children. Insist that your children do the same so that you can also save them. Fellow Kenyans, as you heard the President say, there will be absolutely no sacred people going forward. We have witnessed leaders violating the same rules they should be promoting, and for the most part, many have gotten away with it. The President was clear that this is a thing of the past. Following this directive, we in turn have instructed the public health officers at the county levels to execute this directive and work with law enforcement agencies to close down all violating premises. There will be no sparing of violating restaurants, matatos, as you heard. When owners are found to have broken the rules, they will have their licenses revoked permanently. This is not a threat. It is a plan of action that seeks to protect your businesses and protect us as well, because there will be no exception. There is no VIP. You will not bribe or intimidate our law enforcement officers. You'll be caught and you'll be charged in court, no matter who one is, no matter the political position, no matter the financial ability. As the President said, the Ministry of Interior, the Ministry of Health, and coordination of national government will ensure that everybody and everyone abides by these laws. COVID-19 haitabui VIP, and neither then will we. My dear friends, today I would like to point out something that you should know, even if it belabors the point I have been making. There are now more than 4 million cases in the United States of America. It took 98 days to reach the first million people. 44 days to reach the second million people. 26 days to reach the third million people, and 15 days to reach the fourth million. And as you have seen for yourselves, when we started off, we were growing at a very slow rate. What we have seen now is that in 21 days, we have virtually doubled our figures as well. With freedom of movement and increased human contact, that is what happens. Indeed, ever since we lifted the cessation of movement, our own numbers have surged. While our death remains relatively low compared to many nations, we expect them to steadily climb as well. It is a fact that we must be prepared for. So, what am I saying then? I am saying that back to the responsibility issue, please, and I am imploring you, if you do not need to travel, if you do not need to travel up country, don't. If you can avoid visitors at your home, avoid them. If you can avoid visiting people, avoid it. If you can avoid closing in on people and being too close to them, don't. Don't, because science doesn't lie, and either do figures. We can and we should learn from others where they have succeeded and where they have failed. By taking such steps, we will ease the burden on the government and also save our lives. I have seen people write articles. I saw another one in a foreign paper the other day, where one insinuates that by us telling people to take responsibility, then it means that the government is abandoning its people. I think that is a very foolish notion. Because by the end of the day, it is not the government. It's not a government issue, and we have repeated it here many times. This is an individual responsibility. It is individuals who get sick, and it is individuals who die. So I beseech you that even as we report on these things, let us report from basic facts and not innuendo or rumors. As I always say, if you protect me, I can protect you. Save me, and I'll save you. As I give you today's figures, I would like to call upon our public officers, our Nyumba Kumi, and policemen to be vigilant in enforcing the directives given yesterday by the President. And as you heard, the Inspector General of Police will be submitting a weekly list of establishments closed. My prayer is that you save your establishment. If you have a bar, please don't spoil your business. Please avoid being closed. It is not business as usual. The enforcement agencies have been attacked so severely because of relaxing on this issue. And I want to make it clear, this is a public health issue. It is not an enforcement issue. So going forward, it is the public health officers who are going to go around and withdraw your license and simply tell the police that this particular establishment doesn't have a license and is operating, and therefore the activities that they are carrying on with are criminally liable. So I just want to implore, kama una kabaya yako, tafadhali usifungiwe. Ukifungiwa, sasa wewe ni lazima pengine uende kuanza kushuka ng'ombe, na wewe hujui mambo ya kushuka ng'ombe kwa sababu wewe unajua mambo ya kuuza pombe. Kwa hivyo afadhali usifungiwe baa yako. Fuata masharti yale serikali imesema. And therefore, as they are doing their work, the county governments will be vigilant and will be a lot more aggressive in carrying out this responsibility. The ministry, on another score, has provided each and every county with protective gear for its healthcare workers, so that we should not be expecting to hear complaints about shortages of PPEs. However, moving forward, and in accordance with the resolutions made yesterday in the 5th extraordinary session of the National and County Governments Coordinating Summit, counties will be expected to directly acquire PPEs for all their health workers. In this regard, every county has been given financial support from the national government that is specific to COVID-19 over and above the allocations they get on healthcare. The ministry has gone ahead to provide exemptions to county governments from procuring PPEs from KEMSA and been advised on the qualified suppliers for PPEs. Please use these resources for protection of our people. Whenever the ministry acquires on its own via donations, particularly via contributions from local and international sources. We will be distributing those PPEs from these offices and taking them to the most to the counties that require them most. But the counties will assess for themselves and purchase for themselves necessary PPEs for health workers. This decentralization of provision of PPEs should be a good thing and should now ease any county from complaining about lack of PPEs. Turning to our COVID-19 statistics today, 606 people have tested positive from a sample size of 4,888 samples. This now brings us to a total of 18,581 persons in a cumulative total of 284,500 tests. 583 out of those people are Kenyans, while 23 are foreigners. 409 are men or female or male. 197 are female. The youngest case is 4-month-old infant, while the oldest is 85 years old. The distribution in counties: Nairobi heads the list at 448, Kiambu 54, Kajiado 25, Machakos 16, Uasin Gishu 11, Nakuru 11, Kericho 9, Busia 7, Mombasa 7, Garissa now 6, Bomet 3, Nyeri 2, Narok, Nandi, Embu, Lamu 1, and Muranga has also an additional 1. You'll get the statistics of the detailed distribution of this. But in Nairobi, for example, Embakasi now has become a serious hotspot. If you're living in the Embakasi area, you need to know that Embakasi is a hotspot, and further measures may have to be taken as regards the containment of some of the fast areas that are growing way too fast. So, ladies and gentlemen, without much ado, I just want to once again thank the health workers, because 75 patients have been discharged from the various hospitals, and therefore they have worked so hard, recovering some 7,908. And we want to say thank you very much indeed, and to continue the very good work that you are doing. Unfortunately, we have also lost in the last 24 hours some 14 patients from the disease, bringing our fatality to a total of 299, hitting the 300 mark. And my sincere condolences go to the families of those who have been infected. Kwa hivyo nikiongeza tu hapo kidogo, ni kusema tu vile rais alituzungumzia jana tukiwa wa Kenya, na yale masharti ambayo alitoa jana sana sana kuhusu mambo ya kuuza pombe katika restaurants na pali pengine pote pa kula. Kwa hivyo ukiwa wewe unauza nyama choma, uko hapo katika hiyo list. Mtu akitaka kula nyama, si lazima nyama inaenda pamoja na pombe. Hata soda ni sawa, hata maziwa ni sawa. Kwa hivyo watu wasije wakasema ati mimi nauzaga nyama choma, kwa hivyo mimi sio katika hiyo zile kanuni ambazo zilitolewa jana. Hapana, anything, hata kama unauza nini ya kula, hata kitu gani, ujue ya kwamba huwezi kuuza pombe. Na kuna wengine ambao ni bars, walikuwa hapo awali kidogo, wameanza kuuza chakula kidogo kidogo, mandazi, ndio sasa wasemekane pia wanauza chakula, ndio sasa watu wanunue pombe. Sasa ujue ya kwamba kama ulikuwa umeanza kuuza mandazi kidogo kidogo ndio upate kuuza pombe, sasa wewe endelea na hiyo mandazi na samosa, lakini pombe usahau. Sasa sijui kama utafunga ama utaendelea na hiyo mandazi. Kwa hivyo jameni, tafadhalini, please, tafadhalini, let's save each other. Niokoe na mimi nikuokoe jameni. Hiyo ndio ile kitu, kwa sababu hata ukiangalia vizuri unajionea wewe mwenyewe vile Kenya hii yetu sasa imekuwa. Watu ni wengi sana, kila siku tunasikia watu wanakufa. Hapo mbeleni tulikuwa nasema hakuna mtu amekufa, mtu mmoja amekufa, wawili wamekufa. Sasa kila siku tunazungumza kuwa watu 10 leo hii watu 14. Kwa hivyo tafadhalini jameni, hii virusi iko nyumbani kwetu sasa. Iko nyumbani yangu na iko nyumbani yako. Kila mtu sasa anajua mtu ambaye ameumbukizwa na hii virusi. Kwa hivyo jameni, sisi ni kuwasihi na kusema washeni tuone na macho yetu vile ilivyo, na tuhakikishe ya kwamba tunafanya vile serikali inasema, sio kurasimishwa. Ni wewe mwenyewe ujisikie na jionee vile mambo ilivyo, ndio sasa kwenda mbele tushunge sisi, mimi na kushunga na wewe unishunge. Kuwa ya kwamba leo hii ni watu wengi sana wananiambia sasa, Bwana Kagwe, hii mambo ya pombe ni namna gani? Mimi hata siwahi kusikia story mingi kama zile nimesikia leo kwa sababu ya hii mambo ya pombe. Na mimi nawaambia kila kitu, everything has a silver lining. Everything has a silver lining. Hata kuna watu wengine hujawahi kuwaona hata siku moja, kila siku ukimwona asubuhi anakuwa na macho nyekundu. Sasa hata pengine tutapata nafasi ya kumuona na macho meupe kidogo. Kwa sababu hiyo mambo atalala vizuri, alale mapema. Bas. Asanteni. Any questions?
Elfas Lagat, Citizen TV. I'd like to draw your attention to a video that has been going viral of someone encouraging people to purchase hydroxychloroquine, alluding to the fact that it has treated about 350 COVID patients with underlying conditions. I think one Stella Emmanuel. So DG would like you to address whether these are substantiated, whether the ministry is actually studying these claims, and is there any truth in it? Thank you.
Anita Nkonge from NTV. Anita Nkonge from NTV. My first question is following up on Elvis Langat's question. There were a couple of tablets that were being imported from India, the medicine that, yeah, exactly. That was being imported from India in May, and I was just wondering how far it is, the shipment, and if it is here, how is it doing with patients? My second question is, there was a bit of a confusion on Sunday about the number of positive cases. Is it 892 or 960? Another question, through your targeted testing of public health facilities, how many people have tested positive? And how many people are being contacted? How many people have been contact traced through contact tracing, just to know in total?
Nancy Okware kutoka KBC. Swali la kwanza ni kuhusu huu mfumo wa kuwa wagonjwa kutibiwa wakiwa pale nyumbani. Je, kufikia sasa hivi kizingatiwa kwamba mgonjwa anasalia pale akiwa peke yake kwa muda mwingi, je, kama wizara kuna mpango wa kuhakikisha kwamba mnawapa nasaha ili wasije wakapatwa na msongo wa mawazo kwa kusalia nyumbani kwa muda mrefu bila kutangamana na watu? Na mwisho kabisa, miongoni mwa waliofariki leo hii, je, kuna wale ambao walifariki wakiwa nyumbani ama katika jamii, na vilevile kuna wale ambao hawakuwa na magonjwa mengine na wamefariki kutokana na virusi vya corona? Asante.
Asante. Yeah, okay. One more then.
I'm Brian Otieno from KTN News. I'd like a status update on how public facilities are faring.
I don't know what that means, Otieno. When you say public facilities are faring, And they are not sick. What do you mean?
Are they overwhelmed?
Oh, I see. Okay. Thank you. Asante sana. Thank you, Otieno. First and foremost, let me say that there are some facilities that are stretched as we speak. For example, the facilities in hospitals, private, especially private and public hospitals, that relates to intensive care. Those ones have been stretched to an extent. There are still some beds available, but for sure, those ones are stretched. It is because of that reason that in the next 2 weeks or so, we shall be opening another facility at Kenyatta University Referral and Training Hospital. We are opening a facility there for an extra increment of 500 beds with some 60 ICU beds in the next 2 weeks or so. It is just to cater for that in case. As for the other county facilities, most county facilities that I have visited, in fact, including last week, were fairly empty. Even those with intensive care units, they were actually empty. Most of the isolation facilities in county institutions are also fairly empty. So you will recall, that a while back I was talking about counties not sending people to Nairobi. Quite feasibly then, it is now possible that the reverse may actually be the truth. That some people, if Nairobi gets too overwhelmed before the counties, that it may be possible to do it the other way around. And I'm impressed, never mind the criticism that most counties have been getting regarding their preparedness. I am impressed with the spirit with which I am seeing counties, and I can tell you that the reports, for example, that were in yesterday's papers regarding the preparedness in most counties was actually erroneous. These are just reports, ad hoc reports that come to us at all times because we continue engaging. And sometimes, for example, in the case of Kwale, maybe you visit one hospital in Sambweni, and you say Sambweni has got 72, for instance, health isolation beds. But that's not all they have. They have some other isolation beds in Lunga Lunga and other places, because as we advise them, maybe it is not a very good idea to have all the isolation beds in one spot, because some of those areas are large counties, and the more spread they are, sometimes the better. On the issue of home-based care, I am going to push that on to my colleague, Dr. Amoth, and I'm sure he'll do a good job of it. And again, Langat's question on the issue of case management and how we are handling it, on the issue of India, whether we got staff from India or not. Again, I think Dr. Amoth, you can go first on that one.
Okay. Thank you, Waziri. Let me start with a viral video that trended for some hours before it was pulled down by Facebook, Twitter, and YouTube. And in terms of a pandemic, sometimes there's a saying that goes that in times of a pandemic, due to stigma, fear, hopelessness, it is easy to hawk than sell SARMs. As a Ministry of Health, will continue to sell SARMs, will not hawk SARMs. This video was based on an individual who apparently was addressing people somewhere without any scientific basis. The WHO has given very, very clear guidelines based on randomized clinical trials. You can even Google yourself the Cochrane studies, which shows that use of chloroquine in management of COVID-19 disease does not add any value. To the contrary, it actually can pose a risk, especially for those who have coexisting heart conditions. In each case, it causes what we call abnormal heart rate rhythms or arrhythmias. And it can also cause damage to the liver with untoward outcome.
So there's no basis, there's no scientific basis at all on that video that went viral, and that is why Facebook, Twitter, and YouTube have pulled it down. Let's be guided by science now and forever until we overcome this pandemic. Regarding the question on hydrochloroquine from India, you know hydrochloroquine is a registered drug in Kenyan market and is used for treatment of other conditions including rheumatoid arthritis and systemic lupus erythematosus, which is a condition that affects the skin, the kidneys, and other organs. So the agency of importing chloroquine that time was based on information that was available. But after the randomized clinical trials that were done elsewhere, which were published in peer-reviewed journals, hydrochloroquine azithromycin was adding no value. And therefore, that is why it was even pulled down from the Solidarity trial that even Kenya is a participant. For this, we are going to go with what is proven scientifically. And in Solidarity trial, we are going to use remdesivir. We also pulled down the antiretroviral medicines because they are not adding value. For those who are on home-based care, yes, we will continue to articulate issues regarding home-based care because of the reduction in terms of cost of management of cases for those who qualify. This is a platform that we have used before successfully, and even this we are recording success. And we continue to support those who are on home-based care in totality. It is not just a question of observing your temperature, but as we go as far ahead as giving you psychosocial support together with members of your family. Remember, when you're on home-based care, it's not that you don't have contact with members of your family. It is restricted and supervised contact under the supervision of a qualified healthcare provider. The deaths that were reported today, 14 deaths, 9 of them had pre-existing conditions ranging from diabetes and hypertension combined, or either diabetes or hypertension. 2 of them had cancers. 1 had cancer of the bone called multiple myeloma. 1 had cancer of the esophagus, and the other one had end-stage renal disease or kidney failure. Out of the 14, 4 did not have any coexisting medical condition. And it behoves us, especially those who have coexisting medical conditions, to ensure that we consult with our clinicians and our health care providers to ensure optimum management of our conditions, such that even if you get COVID, then it does not put you at a risk of getting a serious form of the disease. I assure you that if you have a well-controlled diabetes mellitus condition or a well-controlled high blood pressure, the outcome of COVID-19 infection in you may not be different from a person who does not have a coexisting medical condition. So it is imperative that we continue to take our medicines and all the healthcare practices that we get from our healthcare providers to ensure we are in the best state of health. There was a question regarding the figures. Yes, 1 or 2 days ago we had a problem with our figures because of double entry, but which we have since corrected, because you can be tested more than once, and if you don't look at the line list clearly, you'll be able to report that as a separate individual without, if you don't look at the line list critically, to be able to remove the repeat tests that confirm to us that you are now negative of COVID-19 disease and they require to be removed from isolation or treatment. I think Waziri has addressed adequately the issue of the public health facilities. So far, Nairobi, because of established community transmission and because of limited facilities compared to the size of the population, we are a bit under pressure, especially in the private health facilities. And that is why we are thinking of, we are in the process of scaling up another 500 beds in Kenyatta University Teaching Referral Hospital, and with 60 extra beds for ICU care. Thank you, Waziri.
Asante. I think the only other thing that was not answered is the issue of contact tracing. And this is a continuous exercise. Every time we get a positive case, it is mandatory that we must continue tracing the persons who have been in contact with that individual, and as much as possible, try and advise either A, that they can self-quarantine where it is possible, or B, we will provide quarantine facilities where that is not possible. The same applies to what Dr. Ari has alluded to in the matter of self-isolation when you are a positive case. And I think it is important, and we have emphasized this before, but I will continue to do so, that as a matter of fact, the records that we have show that persons who are in home-based care are actually turning negative faster than in hospitals. And so far, I do not believe that we have lost any individual who have been on home-based care. And we pray that this continues to be the case. But and going forward, as the numbers rise, we as families must begin to get interested in what home-based care is all about. In the Ministry of Health website, we are going to publish material for families and advise on how to take care of a loved one if you have got a positive case in your own home. Because you may not have one right now, but there is a likelihood that one is going to be there. And quite frankly, it is a lot easier and a lot more healthier and better that we take care of our own people in our own homes wherever possible. And the other thing perhaps to add, without becoming too scientific about this, I leave that one to Dr. Amoth. I've got a feeling, Dr. Amoth, that there were things you told Anita that she didn't quite follow. You know, at least I didn't. When he spoke about those hyphromatosis, I wasn't sure how many of us were following. I didn't, to confess. As for the numbers that he mentioned about, the 892 and the 960, I think the clarification is really simple. And that is to say that the report of 960 included some samples that had been repeated. Because sometimes an individual comes and turns out positive, there is doubt about the test, or some other person had been tested, and you have seen these cases. The truth is, sometimes a mistake can happen, and the best option for us is to own up and say we give you a figure of 960. However, we have since learned that the number, so many of them, were actually a second testing, and therefore the sample that we had given you is the wrong one. I think it's better to do that and own up to a mistake than simply to convince ourselves that the figures that we give are the correct ones. This is not the only time that mistake is going to happen. We are human beings. It is likely that something like that can occur. And this is not the only place where it's occurring. When it does occur, what we do is that we try as much as possible to ensure that it doesn't happen again. We take measures to protect and secure the testing so that the results that Kenyans get are the correct ones. Thank you all very much indeed.